patient here today who has a mixed amount of scars, a lot of them actually being ice pick. You can see with our side light, they're actually very visible. You can see these little deep, small scars. And she also has those across the cheek, but on the cheek, they're actually a little bit more broad. And so we don't want to widen them. We have to do what I call TCA paint on these. We kind of go around the scar. We lightly paint the acid. And that will give us a nice smoother result. Some of them we still go onto the scar. She is doing a combination treatment today, a much more aggressive one. Again, very specialized in the treatment of acne scars, and which requires numerous treatments over time to get improvement. But this first treatment that she's going to do is going to be a big improvement. And we're going to do a CO2 resurfacing today with a combination of TCA, FRACTORA, and Subcision, and a little bit of Sculptra injections. And you guys know we have a whole protocol, especially with sensitive skin types, with ethnic backgrounds that have risk of hyperpigmentation. You want to make sure that we pre-treat the skin. We have a whole protocol for those that can't get to me at emeragecosmetics.com. But also you can do consults with our team. We can go through it. So right now I'm doing TCA, and if you see when I pull her skin, a lot of those scars actually improve. So we don't really need TCA in all of those spots. Just in some of them, we have these deeper ice pick ones. Shine a little above for me. Bring it down a little bit. Straighter, a little lower. There. Okay. What are they saying?
Right now we have people love your lives. They say we don't have any questions right now.
Okay. So again, I'm doing a little painting here on the edges and some of these, and a little bit more in the center and some.
What is that peel?
This is specifically for ice pick scars. This is a strong acid called trichloroacetic acid, or TCA. This will form little scabs, and it will make the areas fill in on themselves and peel. Okay, now turn right again.
What concentration are we using of TCA?
Stay right there. Hold on, a little less. Right there. Now shine for me on the side. Right. Yep, perfect. Right there. So it depends on the person. Today we're doing 70%. Could do up to 100%. I tend to like 70 or 80. The percentage is not what matters. What matters is the look and feel. Shine from above for me a little bit more. Perfect. We're using the side light to identify as many of them we can from different angles.
How does TCA improve her scars?
So the TCA is going to burn the base and the walls of the scar, creating a scab, and then it fills it in. Sometimes it actually looks a little worse at first, and then over time it fills it in. This combination is really going to help her get a better result. Okay, let me see you straight for a sec. Shining right there is perfect. She's a couple little ice pick scars on the nose. She's all numbed. Shine from the side over here. Perfect. She's all numbed. So about 80% of her face. That's actually perfect. All of that is absolutely perfect for the TCA. So if you do a pan, you could see.
What kind of scars are you covering?
Can you guys give her a little gauze with some water that we can just dab some water in her mouth? These are the ice pick scars. That's why her mouth is going to get a little cottony. Okay, so that's perfect for the TCA. If you guys take a look, we hit pretty much every deep pore.
Will this work on stretch marks?
No, unfortunately not.
But if you do have stretch marks, we do have treatments for you.
Let's do the sculpture. Let's do the Subcision sculpture. Just give you a little water in there, okay? Just sip the best that you can, just a little. Okay? Good. Sometimes the nerve blocks, you guys, make the tongue a little dry. Okay, so now we're going to do a little Subcision. I'm going to turn you this way. The main area of Subcision, yeah, I just need the main area of Subcision I want to do on this side is kind of right here. We're going to circle a small area, not too large. We don't need to overly do subcision if she doesn't need it, because it can hurt the tissue. So I'm just going to do a little bit right through here, and then on this side, we're going to do a little bit right through here. Perfect. Okay. So go ahead and grab that. We're going to do one little needle poke. You may or may not feel a pinch. Perfect. And we're going to use Sculptra while we do the subcision. So you guys can see that here. That's what I call the snow globe filler. Even though it's not really a filler, it's a collagen producer. And it actually goes into the skin, and it tells the skin, you're going to feel a little movement, to start producing collagen in this area. So it actually will really help her over time build right underneath these scars. Perfect. There's a little numbing inside, so she may or may not feel it. We've already numbed a lot of the area. We have another half.
Dr. Emer.
So we're using the Sculptra as a numbing agent to build collagen here. Shouldn't really be feeling. Are you feeling any of this?
A little bit.
But not too much. Okay, good. So you guys see I'm doing a little subcision here. Good. Good. And that's all I really need to do. She doesn't have, most of these are more ice picks and broad scars. So we're using this cannula right under the skin. Look
Will
at
this work on stretch marks or the stomach?
No, unfortunately not. This is for scars on the cheek. This isn't for stretch marks, but we do have laser treatments for the stretch marks. That's perfect.
The same person is asking,
Hold here.
I'm in Maryland and want to come travel to see you.
Come see us in New York. We're going to be there very soon, you guys. We can do a virtual consult now. Tell them how to do that.
If you do need a virtual consult so you can come see us in New York or come see us here, send us a DM with your full name, phone number, and email. Or you can reach out to us at appointments@jasonemermd.com.
So now we're going to the other side. We're going to do that same thing. A little bit of Sculptra underneath the scars.
Is she conscious? Yes,
Yeah,
she is.
she's here. She's doing great.
She's a thumbs up right there.
She's got a thumbs up. So again, not a lot of Sculptra. You don't need a lot.
Someone says you're being very rough.
We need to be, you guys, to get these scars to lift up. If you don't, you can't get the same results.
Someone said, can you give me an update of what's going on, doctor?
Yeah, tell them, Jordan, what we're doing.
Right now we just did TCA earlier right here.
So
You can
all this
see the
frosting,
burning.
and look at the painting, is from TCA that's going to help the deeper scars, those ice pick scars. Now we're doing Subcision, which lifts some of the scars that are more indented but broad, the ones that I did the paint on. Okay? And so I'm doing that right here. The key really for her is going to be doing the lasers. And then the last step of my first part is going to be microneedling radiofrequency, which is FRACTORA. That's deep needles. It's actually going to really help these types of scars. Hold here. Good. Perfect. Okay, so now we're going to go to the fractional.
Let's see how she's doing.
Check off.
You guys asking what is going on? We are doing acne scar treatment. We're doing a combination treatment. We've done TCA, we've done Subcision. Right now we're doing the FRACTORA.
So the next step, the last step in my first part is going to be FRACTORA. Because you guys see these broad scars and some of these ones that we just got with the acid, we need to go deeper underneath them. So we're going to use these needles, 24 pin, to work on the scars that are more broad. It's going to combine with her laser. This is called FRACTORA, in my opinion, one of the best microneedling radiofrequency devices. This helps scars and fine wrinkles, but it doesn't really help tightening. She doesn't need that though, she's young. So here we go, we're gonna start. She'll feel it in some spots, but not in many.
No, this is not plastic surgery, guys.
This is cosmetic dermatology.
For those of you asking for a price, you will need to send us a DM with your full name, email, and phone number. We'd love to book a consultation with you and get the perfect treatment for your situation. Or you can send us an email at appointments@jasonmd.com.
And I am going into the skin with the needles, you guys. This is actually puncturing the skin.
Can you give me a nose job?
Well, our team does that, you guys. We have 3 doctors that do rhinoplasty. If you want that, come in. We're talking about acne scars right now, but yes, we can do a consult for you for rhinoplasty. Just tell them how to contact us. But you guys, look, we're doing this combination right now with the scars. She's actually doing really amazing.
Someone said, I wonder if she can feel anything.
How is the pain level 1 to 10? What do you think? 2?
We got a 2.
Oh, wonderful. That's actually really good. That means you're very high pain tolerance.
Someone
And
said,
that's
why,
really good.
why not Morpheus 8?
Morpheus is for tightening, you guys. This is for scars. That's why. Turn it this way. And also, this really goes really well with the laser. So you see how we're really pressing the skin, working to tighten, to go deep underneath the scars. She's doing really well because she has nerve blocks. She also has a really high pain tolerance.
What is that white stuff on her skin?
So that's the frost from the TCA. That's actually skin burn in a controlled way. It's gonna make the scars appear wider at first, and then it's gonna fill them in over the course of the next 2 months. And it's gonna help us get her a bigger improvement in her scarring. So now we're combining that with the microneedling radiofrequency. We're doing deep RF. This is going underneath the scars.
Is 1 session enough?
No, unfortunately not. She will get a big improvement though. In 1 treatment, I can already tell. Her skin's gonna do really well. This is her first big treatment. Just do a little bit extra.
Why does she not need eyeglasses on for
Because
this?
this is not laser. This is radio frequency. So she really doesn't need it.
Why isn't she opening her eyes or blinking?
She can. Do you want to blink for them?
There you
And
go.
she's
A little
smiling.
smile.
Guys, my patients are fine. They get so scared for my patients.
Are the needles sharp?
Very sharp, yes. See? Very, very sharp. You don't want to fall on those. So that was it for our first part of our combination. I'm going to give you this. You guys can see, if you look up close. Excellent. We're going to start, if you want to stay on, we can do the deep laser right now.
Yeah,
We can pause for the other. Give me the white pencil again. So now I'm going to remark, and here's the thing. I don't want her to have hyperpigmentation. So my idea, we're going to focus on just the important areas for deep.
What'd you do to make her so relaxed?
She's got my voice, you guys, my touch. It's my touch and feel. So we're going to focus on the areas that she needs the deep laser, not every area of her full cheek, because
Why is she not bleeding excessively?
we do this a lot and we know how to do this right.
This how you come to professional?
We need to go to a professional for this, I would say. So here's the deeps. Now we're going to put a shield on her. Keep her focus on her. I don't want anyone to see this. Hold on. I need my bubble goggles. She's doing really good.
Do you also do blackheads?
Yes, our estheticians do.
There was a few I got her eyewear. Her eyewear is on. We're about to start lasers shortly.
Okay, so I want
Ask
you
the
guys.
patient if she likes the feeling.
I want you to take a quick look at the goggles because I helped create these goggles. These are from Innovative Optics, you guys. This is one of my favorite goggle company in the world. And look, we did a little collab, Jason Emer MD and Innovative Optics. So any of the doctors that are watching, definitely call them, get these amazing goggles. I need my goggles and then we're gonna start. Okay, good. Let me give you this back. So you see the areas we've outlined. some doctors actually don't even do this part. They don't even do the deep because they're nervous about issues, not doing it correct. No, these are okay. They're nervous about the issues that they typically can get.
How long have you been doing this for?
Oh my god, 2006. Alright, so I'm gonna do a test spot so you guys can see, get suctioned, and then we're gonna start. Hold on, we'll speed it up. This fog. I'll let this down. Okay. So this you shouldn't feel so much, it shouldn't be too bad. We're gonna test spot first, here we go. Another one just to make sure, perfect. Always test on someone other than your patient. Turn to the left a little for me. Perfect. So now we're gonna start. She really shouldn't feel this too much. Now, like I was saying before, some doctors don't even do this because of the risk of hyperpigmentation and also just downtime. But again, we really need to get her a better result, and with the right peeling and skincare, this should heal totally fine and do really well. Yes, she'll have a little hue of some redness for a little bit longer, but you know what? That's collagen production, and it's gonna give her a really good result.
How long does this treatment take?
An hour, maybe longer. So this is the Deep FX. This is what the government uses for burns and scars. Amazing laser. I had this before anyone did many, many years ago. And it's still to this day
What laser do you do?
the gold standard for scars. What do you mean?
Someone said, what laser do you do? I think that's what we're using right now.
Well, you know what this one is, the Deep FX. This is all luminous. So you guys see, you can barely see anything happening because the actual dots of this laser are minute. How does the pain level? Is it more than a 2 now or no? What do you think? It's a little higher, or your thumbs up? 4. Okay, so it went up a little bit because in some areas she's not fully numbed because the nerve blocks.
Is she going to be swollen in the morning?
Oh yeah. Yes, she will. Definitely want if they can bring in ice packs, or do you have them already? Okay, we'll do them in a sec.
What does radio frequency do to her skin?
It helps remodel the collagen, tighten it, improve the scars. So you guys can see we're going in here and little dots are forming new collagen. She's gonna look all scabbed, but it's gonna improve her skin. And again, like I said, combination treatment very few doctors will do, but I want her to get a really big improvement. So we're going strong.
Can you remove pimples?
Yes, of course. Tell them how to make a dermatology visit or do an esthetician consult at emeragecosmetics.com. Skincare. Okay, so that side's pretty much done. All right, grab an ice pack there. So if you guys take a look, you can see the little bit of swelling in little boxes. Take your right hand and hold this ice pack for me, okay? Yep, right there. Just go ahead, put your hand up. There you go. Just hold that, now turn your head all the way to the right. To the right, that's your left. Keep going, keep going.
The other one.
I'll cover you. Perfect. Okay, now we're gonna do the other side. A little bit less, a little bit less. Right there, perfect. Okay, so now we're starting on this side. And you're not gonna see bleeding with this laser, unlike Cyton that we showed you before with the Fractional, because this is CO2, and the CO2 coagulates and heats the skin much more. So you don't get as much bleeding. But you're gonna see a lot of swelling. And you don't want this to be exactly perfect, because you want spaces of healing. So people always ask, why do I have little streaks or whatever for a short time period? That's normal. That's the collagen production. What are they saying?
Would this help with rosacea?
No, this is not the treatment for rosacea. This is for scarring and wrinkles.
When do you when does the healing stop hurting?
It doesn't really hurt, you guys, during the healing process. It actually feels fine. It hurts during this treatment, which is why we do the nerve block.
Something. Why is this treatment incredibly fast-paced?
That's what it is. I don't know. That's how long it takes. What do you mean?
Someone's impressed by how quick.
I've done it for a long time. So you guys see I'm being very meticulous, following each of these spots in rows. It's very important.
This is our deep laser, right?
What?
This is our deep laser.
Yeah, this is a deep FX.
So guys, those guessing what this is the deep FX laser. Previous fits we did TCA, we did the subcision already. We were
Talk
treating
louder.
acne scars.
Talk a little louder.
And we did the FRACTORA.
Yep, we did FRACTORA, we did Subcision, TCA, and Sculptra for collagen. Now we're doing the deep FX, which is going to really fill in the scars over the course of 2 months to 3 months.
Is
What?
Is this a fully ablative laser?
No, this is fractional laser, not fully ablative. Okay, so now, hold on.
A bunch of people have been asking about stretch marks.
Let me see this other side. Let me take this down, okay? Relax your hand. Hold on. Bring your hand. Perfect. Okay, we're good. Now I'm going to have they hold the ice pack on the other side, okay? Use the other hand. Switch the ball. Perfect. So now we're done with the first part. We will come live in a minute for the second. So that was the end of the deep. Take a look. You can see the swelling. You can see all the little dots in the areas. Right now, not really noticing too much, but you will start to see a lot more over the next few days to months with the deep. You will see much more with the active, which we'll do in a second. Good. All right,